Hello, my student. In our lecture for today, we are going to talk about autonomic dysreflexia. The lecture should be a guide to acute nursing care to prevent and educate about autonomic dysreflexia. The objectives of our lecture. All of the students are listening to this lecture should be, after this presentation, be able to understand what autonomic dysreflexia is and know how to manage an acute autonomic dysreflexia crisis. Also, they should know some ways to prevent autonomic dysreflexia and effectively educate patients on the management and prevention of autonomic dysreflexia. What is autonomic dysreflexia? Autonomic dysreflexia is an abnormal response to painful stimuli below the level of spinal cord injury. It's mediated by the autonomic nervous system, also known as a hyperreflexia and autonomic dysautonomia. Most common in a spinal cord injury above T6, which is the sixth thoracic nerve level. Also, it can cause dangerously high blood pressure, which is considered to be a dangerous sign on the patient life. For that, it is a medical emergency. The autonomic dysreflexia risk present when the patient most at risk of autonomic dysreflexia are those with spinal cord injury above T6, who have passed through the acute stage of spinal cord injury and have had a return of reflex activity. It is a medical emergency and must be treated with prompt action. The action should be given immediately at once when the signs of autonomic dysreflexia appear. High blood pressure can lead to heart arrhythmias and stroke, which is, as we know, it's a dangerous situation. Repeated episodes of autonomic dysreflexia can cause long-term organ and vascular damage. The diagram in front of us, when we want to talk about the pathophysiology of autonomic dysreflexia, we should know that the red line in this diagram is the line when autonomic dysreflexia appear or considered to be a crisis on the patient or not. That red line is the T6 line, or the level of sixth spinal nerve level. Pathophysiology act in painful, noxious stimuli occur below spinal cord injury level. A signal is blocked at site of spinal cord injury, so patient is not aware of pain and cannot correct it. Autonomic nervous system respond to that stimuli, so the autonomic nervous system, the vasoconstrictions below spinal cord injury, it will be increased, sudden rise in blood pressure, which is the, as we talk about, is the dangerous situation occur in autonomic dysreflexia. Autonomic nervous system detects high blood pressure above spinal cord injury and attempt to correct it. When the body, our body, want to correct that rise in blood pressure, the bradycardia occur as stimulated by vagal nerve, the vasodilation in head and chest to absorb increase blood flow to upper body. Negative feedback loop is interrupted by the spinal cord injury. This cycle continues until stimulus is removed, which is the cycle of this cycle is made our crisis situation in autonomic nervous system, in autonomic dysreflexia situations or spinal cord injuries patients above T6 spinal cord injury. The causes of autonomic dysreflexia, the number one cause is full bladder. The number two cause is full bowel. The full bladder and full bowel act as noxious stimuli to the autonomic nervous system, and the painful situation occur at the autonomic dysreflexias or spinal cord injury patients. Also, there's other causes such as bladder or kidney infection, gastric ulcers, gallstones, other GI disturbances, tight clothing, leg braces, shoes, patient lying on sitting on hard objects, pressure ulcer, ingrown toenails, insect bites and other minor injuries, and deep vein thrombosis. Other common causes is sexual activity, menstruation, which is occur. The menstruation act as a painful stimuli at the menstrual cycle, as we know, in the female patients. The pregnancy, the vaginal infections, the extreme temperature, hot or cold, rapid change in temperature, positioning problem, lack of circulation to limb, drug stimulants. Signs and symptoms. The systemic signs and symptoms is rapid rise in systolic and diastolic blood pressure, 20 to 40 millimeter of mercury above patient's baseline. Bradycardia occur. Possible cardiac arrhythmias, the A fiber, the BVCs, the AV conduction abnormalities or atrioventricular conduction abnormalities. The observable signs, which is we can observe the above spinal cord injury site, the profuse diaphoresis. Diaphoresis occur in the patients at the above spinal cord injury site. The goosebump, which is piloerection, flushing of skin, special face, neck, shoulder, may have blotchy appearance. The symptoms which is appear on the patient of autonomic dysreflexia, the patient reports severe headache, blurred vision, spots in visual fields, nasal congestion, anxiety, sense of impending doom. Silent autonomic dysreflexia does not have symptoms despite significant elevation in blood pressure, which is considered to be the most dangerous situation because of the blood pressure does not go collaterally with the pain, which is can be alert us to the make an alarm for the patient and for the caregivers that the patient has an episode of autonomic dysreflexia. Acute care for nursing plan goals is gonna to be allocate and remove stimuli, lower blood pressure, administer prescribe medications, notify the doctor. We have the step-by-step care. The first step of the care is sit the patient up. This will help to reduce the blood pressure to the head and upper body. Patient must remain sitting up with head of bed elevated to 90 degrees until crisis has passed. The step 2 is loosen restrictive clothing. This will allow pulling of blood in lower extremities to reduce blood pressure. It may also be the source of the crisis. Remove shoes, loosen braces, remove elastic, anti-embolism stockings, and inspect for any other sources of pain related to clothing or devices. The step 3 is closely monitor blood pressure. Attack intermittent blood pressure device and check blood pressure every 5 minutes or more as needed. This will allow you to identify whether or not you have identified the problem. For example, if you have catheter the patient or cath the patient and that result in an immediate drop in blood pressure, then the source has been identified. Otherwise, continue to investigate the causes of the crisis. If you have a cardiac patient, apply 6 lead EKG at this time. Some protocols indicate that a systolic blood pressure above 150 millimeter of mercury requires pharmaceuticals intervention. The step number 4 of our care is check the bladder. As we talk about that the full bladder is first or number 1 the cause of autonomic dysreflexia. If the patient has a fully cath, the check for anything or of any kinks or obstructions in the tubing. If Foley is not draining, replace it. Call a doctor if there is any difficulty replacing the Foley. Cath the patient to empty the bladder. Apply lidocaine jelly to the urethra 2 minutes prior to cathing to avoid further painful stimuli. If there is a doubt about the bladder being empty, use a bladder scanner. Observe patient's urine and odor or discoloration may be point to bladder infection or kidney problems. Collect sample for analysis. The number 6 step or the step number 6, check the bowel. Impacted bowel can often lead to a crisis. Applying lidocaine 2 minutes prior to digital disimpaction while the patient is in the lateral position. Check patient's sacral area and buttock for pressure ulcers or other causes of pain. Inspect area under patient to make sure that when not lying on any object such as an IV cap. A digital rectal exam may exacerbate the crisis. So the digital rectal exam should be avoided if the blood pressure rises during the examination. Stop, install more lidocaine and call the doctor. The step number 6 of our care is check for other anoxious stimuli on their body or the patient's body with autonomic dysreflexia situations from the toes up. Then check for any other sources of pain. Start at the feet and work up. Inspect for any grown toenails bites, scratches, or other minor wounds. Check for pressure ulcers under the heels. Make sure socks and bands are not tight. Loosen leg braces and bands. Make sure the leg opening of underwear are not constricting the upper thighs. Check to see if female patient has vaginal bleeding or discharge. Check male patients to see if they are lying on the scrotum. Check for discharge or swelling. Make sure patient is not too hot or too cold. Check temperature to detect a possible infection. So the care can be abbreviated by the 5 B's, which is bed up, blood pressure, bladder, bowels, body. The medication which should be given to the patient with autonomic dysreflexia, which is often standing orders by the doctor, as we know, the systolic blood pressure should be above 150 mm mercury. Brocardia, we should give brocardia, which is nifedipine. The action of this medication given immediate release tablet as immediate release tablet, bite and swallow, which is given a rapid action for the patient, which is may release or relieve the crisis situation for patient with autonomic dysreflexia. The nitrates also given as nitroglycerin based. The base should be acting rapidly also. Others, which is mecamylamine and diazoxide and phenoxybenzamine. If the crisis unresolved for the patient who have an autonomic dysreflexia, if a noxious stimuli not identified and the crisis unable to be resolved, if the patient was inpatient, we should call a doctor. If the patient was in home health, call 911, make sure situation explained for the respondents, and teach patient to call 911 or go to the emergency department immediately when the stimuli occur. How we can prevent this situation? The prevention is often the key to preventing an autonomic crisis. We should regular bladder and bowel care. We should have to prevent of pressure ulcers and inspect patient bed, often for foreign bodies or foreign objects. Check records for past crises and causes, which is may be recurrent. Those causes may be recurrent. Avoid tight fitting clothes, abrupt change in temperature. And the patient teaching is the key for the prevention of this situation, the autonomic dysreflexia patient situations. The AD kit for home and travel should be given to the patient. Catheter, bowel care, educate family, friends. The ID card with the patient, that the patient have an autonomic dysreflexia situations or have spinal cord injury above the T6 injury, with a plan of care in the such situations. Emergency app on phone. Emergency application should be uploaded to the patient with autonomic dysreflexia on his phone to give an alert for those who is respondent or responsible for his situation. The medical bracelet should be worn by the patient. Thank you, my student. and we will gonna to be reach us in the another lectures. Thank you.